I represent Mississippi. We're less than 3 million people. And one of our largest challenges is rural health care and getting these vaccines to rural areas such as those in Mississippi. Of course, I'm very concerned about the universities and colleges and the protection that we need there through that age population. But I'm just going to ask you, what are your agencies working on to help address the challenges in unique rural America's response to COVID-19? But mainly, how can this subcommittee support you in that? How can we address there, those issues there? And I'd like to hear from all three of you on that and getting the vaccines to rural America where it needs to be, where we have such a challenge.
Thank you very much, Senator. Very, very important. We have continued to try to develop outreach and vaccine distribution, particularly in the hard-to-reach rural areas. This is part of the efforts that we've accelerated with our flu program right now, with the idea of how to vaccinate with confidence by trying to protect communities, empower families, and stop myths. We've developed rural partnerships with the National Rural Health Association, the National Association of Rural Health Clinics, and the National Organization of State Rural Health Offices, with the goal to really work to improve the acceptance of vaccination in general, flu being the important one with confidence. I do think the recent decision that the Secretary made in expanding the ability of pharmacies to vaccinate down to age 3 to down to age 18 is going to be an important expansion of being able to engage pharmacies throughout our nation as vaccine centers. But we're continuing to work with those rural organizations to see if there's other innovative solutions to try to expand vaccination. I am hopeful that the pharmacy expansion is going to have a significant impact.
Thank you very much.
Ma'am, with regard to rural health care, what ASPR's been doing in the last years prior to the COVID event was trying to expand what would be the regionalization of disaster care, emergency care, to really focus on areas where you have critical access hospitals or underserved populations. In the current COVID event, we've been working with the Department of Defense to employ a system that they originally started, which was called the National Emergency Telecritical Care Network, or NETSN, which is a means by which to do telemedicine to, again, rural and critical access hospitals to make them available the best information, critical care specialty support, as well as arranging for transportation and referral of cases to a higher level of care. So we're actively doing that right now. We've done it in many parts of the country as a result of our work in COVID response. And we're also trying to do that for ambulatory care telemedicine as well. So by building out our regionalization approach, our hope is not only create those established referral patterns, but also establish telemedicine consulting support so that we can support the rural parts of this country over.
Thank you.
And I will add on, again, with the PrEP Act guidance that allowed pharmacists to do COVID vaccines. I issued that last week to get in the pharmacy communities. But I just want to be a little bit of a cheerleader for federally qualified health centers. We now have 221 federally qualified health center sites in Mississippi performing testing. I think FQHCs are a real gem. They take care of 30 million people and very much of the underserved, migrant farm workers, homeless, and they do so at a savings, better outcomes at less cost. So again, that's a major point for us in Mississippi, where we're reaching people, both urban and rural, and anything I could do something for HRSA in the health centers, that's going to be money well invested.